Let's talk dentures. Actually, let's talk implant-supported dentures. I call them the hybrid dentures. And basically a solution to be able to have enormously day and night type of stronger dentures, better dentures, more confident, and lots of other advantages. Why don't you explain that concept to us, Dr. Piskin?
Sure. Well, the main patient that's going to understand the truth about this discussion is a patient who's wearing an existing denture and knows the difficulties that they have and struggles that they have in keeping a denture in place, making it feel like their own. And
that's 30 million people in this country, by the way.
That's a lot of people, and
lots of people.
Tried things. They got glues, they got the different adhesives, and there's some controversies with that right now. But we're not going to talk about that. But they don't like to use that stuff, and it gets all gooey, goes down. They have to keep reapplying it, and over time, the denture gets loose. Their bone that supports the denture starts to disappear over time. They call it atrophy, and then what do? And then they have less to hold on to. So the idea of being able to use what we call a denture over denture or a snap denture on implants is an amazing thing. They're ecstatic when they can have this done. And basically just put in a couple simple implants in a couple spots that the denture can now snap on or clip on to these implants that are held in. And that denture becomes something that is very difficult to take out easily, and they can chew and speak and not have to wear the adhesives and the goo, and it feels really comfortable. And more importantly, especially on the top, they can actually have it where the palate is open, that they can taste their food better, and they don't have to have the whole upper gum area covered with some plastic acrylic denture. So the idea of an overdenture or a snap denture that goes on implants is a great alternative for someone that struggles with just something like a full denture and it doesn't work very well, or they just hate all the goo and the other stuff that helps to try to hold this in place. So that's the idea of what an overdenture is, or a snap denture on implants. It's amazing.
So basically what you're saying is, because a person wears denture because he has lost his teeth. That's
right.
Right, all right.
A full denture, there's nothing left.
Right. And because a person has lost his teeth, any particular tooth, but as more as a teeth a person has lost, as more and as faster the bones where the tooth are in it, the roots are in it, will shrink. It's just the bone basically says, I'm useless, because that was the bone's use. And so when a person wears denture a year, 2, 3, whatever it might be, it's not that his denture becomes bad and wears out like a pair of shoes might be doing, but that the bone in the body shrinks and so the whole thing becomes wiggle woggly. And even at the very beginning, when it's good fitting, people who first time have a denture, thanks God, it's not something I had yet to do in any shape and form. They kind of they lose quite often confidence, because their whole biting experience is just such that they go, my God, this is not how it used to be. And what you're saying is an implant-supported denture can fix that and makes that biting. With an implant-supported denture, can you bite into an apple? Can you chew on a prime rib? Yes or no?
Yes, absolutely. You know, you could have someone that's wearing dentures and have them bite on one particular thing, or ask them to crush a pencil or anything like that. They can't do it. But something that's supported by implants, you now ask them to chew or bite down, they're going to be able to have an enormous amount more force to bite and mush the food that they didn't have when they just had plain dentures. Like you were saying before, you were right. When you put implants in, you preserve the bone. You leave it with no teeth and just a denture, the gum and the bone will shrink. The denture hasn't gotten bigger, everything that, and that takes time, but over that period, that bone can't grow back. So you want to try to do this as soon as you can, and think about maybe putting some implants in to support that denture.
Right, because in the price, you have it's a little bit more expensive than a denture, but a tremendous amount less expensive than a full set of implants. Am I right there?
There's no comparison. It's significantly less expensive to just have a couple implants with some snaps, and the service that you will get is tremendous. So you don't have to think that you need $30,000 to create this type of thing. A few $1,000s extra for some implants and snaps is really all you need, and you will be really surprised how well the denture stays in. And some people really struggle on just trying to take it out, and sometimes we have to make it a little bit less retentive so that they can. That's how strong these are. It's a great service for patients. They love it.
Beautiful. Well, because probably the smile for no reason. People say, $1 million smile, and it's the most wonderful thing. Now, a good denture without implant support probably can give you the same smile. But when people have just a feeling, even if it never happens, that those dentures might come up when eating, talking, or whatever, that alone puts a self-confidence thing on people, and so that is gone. And you mentioned about the tasting. You see, we don't really taste quite as much of our food with the tongue as we think. It's really up in the on the palate, and it's a change of lifestyle. Well, anyway, wonderful. I'm glad that you brought that up, and it looks like that's a really great solution in terms of economically tremendously cheaper, and yet giving you, pretty much the same than all implants. Thank you very much, Dr. Piskin.
You're welcome.